people are getting afraid of Omicron. Why? Because the news media is scaring the shit out of them again, and so is Anthony Fauci. There's a headline: Omicron is going to take over this winter, and Fauci says Americans should brace for a tough few weeks to months. It's going to take over. That sounds scary. It's going to take over.
I thought Fauci took over.
Yeah, me too. It's going to take over. I wouldn't be surprised, Max, if it tried to obtain yellow cake uranium as well. Hey, maybe besides
it's mailing white powder out to key members of Congress.
Yeah. Well, now I bet because of Omicron, we're going to start having to take our shoes off when you go into a restaurant. You know how well it keeps you safe going in a plane. Why wouldn't it keep you safe going into a restaurant? So here's all this. Look at this. COVID-19. WHO DG recommends canceling holiday events. Deadline: Canada's Quebec province shutting down movie theaters over Omicron. Here it is, Los Angeles. California braces for Omicron wave amid grim forecasts. As Omicron surges, nations announce rules that gatherings and travel. Just in, Mayor Bowser declares a state of emergency in Washington, D.C. And here's what that includes. A part of the state of emergency, Bowser said the city will reinstate the citywide indoor mask mandate, as well as instituting the D.C. government vaccine mandate to include the booster shot. So now if you just had 2 jabs, you are unvaccinated in Washington, D.C. Bowser said the district will expand testing and blah, 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 blah. So that's what's happening in D.C., and I just want to show you, some people are loving it. Good. She needs to announce a 2-week hard lockdown starting tomorrow. No one allowed to leave their house for any reason. Food and other supplies delivered to your door. China and Australia implemented this, and it worked. Just to let you know, the last time they did this, the same DC mayor had a maskless party hours before the mandate kicked in. That was the last time. Now, I want to play this, Max, and then I'll get your comment on it. This is Dr. John Campbell, and he's going to tell you about the symptoms related to this scary Omicron virus. Ready? Variant. Here we go.
Top 5 Zoe reported symptoms. So this is the early London data, right? Most common, runny nose. Second most common, headache. Third most common, fatigue. Sometimes the fatigue was bad, sometimes it was mild. Fourth most common feature, sneezing. Fifth most common feature, sore throat. The implication is obvious. If you have any of these and you've had colds in the past, you're going to think it's a cold, but it may well not be. It may be a Omicron cold.
So did you see him say that? If you've had a cold, you might mistake this for just a cold. But it's not just the cold, it's the Omicron, which feels like a cold. Hang on, watch this.
Get tested. Now, slight difference in the presentation in South Africa. We looked at this before. So in South Africa, blocked or runny nose, check, that's the same. Headache, check, that's the same. Tiredness, check, that's the same. Now, London, in the UK, it's described as a sore throat. In South Africa, it's described as a scratchy or sore throat. So I think that's the same. The big difference is in the UK data, fatigue is a much more prominent feature, although we know there was fatigue in the South Africa data. But the body aches were a prominent feature in South Africa, whereas that doesn't seem to be such a feature in the London data. Now, why is this? Could it be that body aches are more likely to break through as a symptom in people that have had previous actual SARS coronavirus 2 infection, because we know that's where the majority of the immunity comes from in South Africa. Whereas maybe the vaccine, because we know the majority of immunity in the UK comes from vaccination, the vaccine provides more protectiveness against body aches. That could be the case. So it could be the difference in the nature of immunity. But as far as the UK is looking, and I've no reason to suspect this will be any different in the United States or Europe or anywhere else, this is, in most people, presenting as a cold. Mild and self-limiting in the vast majority of cases. So there you go. Runny nose, headache, fatigue, sneezing, sore throat. Think, is this Omicron? It could well be. And test and behave accordingly. Essentially the same as the South Africa data with that bit of difference. Now, I hesitate to give you the official NHS NHS symptoms because it's just becoming a national embarrassment, to be quite honest. It is so out of date. Now, to be fair, I did take this off the website about 25 minutes ago, so they could have updated it. I took this off the website just before we came to do this video. So they could have updated it in that time. I mean, they haven't in the last 18 months, but they could have done. NHS official symptoms, a high temperature, a new continuous cough, loss, change in your sense of smell or taste. I mean, this is just 18 months out of date. What is the NHS playing at here? It's just embarrassing. Now, it can present like this, but we know from contemporary data, and we like to be up to date, that that's what we get from the Zoe symptom tracker data. That's what we've got from the clinicians on the ground in South Africa. This is what we continue to get from the NHS in the UK. So yes, it could present as a high temperature. Yes, it could present as a new continuous cough. Yes, there could be a loss of the change of sense of taste or smell, but normally not. Normally, the vast majority, we believe, are these features here. Why on earth these features have not got through to the NHS website is a mystery to me. One of several mysteries about the official response to this pandemic, it has to be said. Right, getting back to Tim Spector.
So there it is. It's presenting as a cold now. Now, Dr. Robert Malone was on this show. The guy who invented the mRNA vaccine technology was on the show, and he predicted that the virus would mutate to become more contagious and less pathogenic, meaning less deadly. And so that's exactly what the Omicron is. That's exactly what this is. So now people are freaking out. Here's one more. Here's Nature magazine. How severe are Omicron infections? It says on December 14th, the South African private health insurer Discovery Health in Johannesburg announced that hospitalization risk had been 29% lower among people infected with Omicron compared with people infected with the previous variant. This has fueled suggestion that Omicron causes milder disease than the previous variants, but research says it's too early to be sure. So, Max, are you surprised at all the freak out? And it's completely manufactured, right?
If there's one thing we can predict, it's that there will be another freak out to generate a permanent emergency, because this is just too good of an opportunity for too many people to relinquish control and let us go back to our lives and treat this virus as it is. I mean, what Malone said is just like virology 101. I mean, mutations are not, we talked about it before, mutations are not inherently bad, but you just hear this word mutations and you think of like mutants rising from this toxic slime. You think of all of like the Andromeda strain, but this mutation may be, as Vladimir Putin, the Russian president, called it, a live vaccine that actually has the effect of infecting many people with a very mild, not very virulent strain and doing what a vaccine was supposed to do. And as we know, natural immunity is stronger from just an array of studies of hundreds of thousands of people. But, I'm in Washington, DC right now. I was out today, just all around the city. The mask mandate was relaxed a few weeks ago because DC was following the data. DC is not having a hard time with COVID at all. Hospitals have not, ICUs in the hospitals here have not reached their peak capacity. Possibly, I think at any point, COVID deaths are comparatively low. The vaccination rate is pretty high. But basically, there's no real COVID emergency here. But people tended to keep their masks on. And it's because the city did no public information campaign. The mask mandates, you can show your faces again, blah, blah, blah. But if you didn't wear a mask in a store or the gym, then you could do that. So basically the relaxation of the mask mandate has nothing to do with whatever's taking place in DC. What are the numbers? DC hospitalization rate has gone down in the past week for COVID. And in fact, according to the latest hospital reporting statistics in DC, there are only 12 people in the last reporting cycle who are in an ICU with a positive COVID test. That's out of 358 people who are occupying ICU beds. and there are scores more beds that are open. So the hospitals are not bursting to the seams here with COVID patients. The number of COVID patients in there is minuscule, but the mayor has declared an emergency. Why? Because we hear about cases. That's all we're hearing about is cases. We're not hearing about hospitalizations. It's cases. And what I saw around DC today was not like sick people dying or people, worrying, although they're being told to, but people lining up at testing centers, often paying lots of money to get tested and to get rapid tests because they're being asked to at the workplace or they're being asked to for the holidays or whatever. And so you have record testing leading to a record surge of cases. And the testing has never been interrogated by the media. We haven't been told by the media how many cycles the PCR tests are being run on. But Anthony Fauci himself said if you run the test at over 35 cycles, you will likely pick up anything, including a bunch of dead nucleotides, which will then register as a positive test. So how does the PCR test work? It basically, it amplifies DNA at cycles through the change of temperature in order to find a disease or virus. When it was applied, for example, to detect HIV in a very revolutionary way. It's been revolutionary for crime scene investigation to find DNA at crime scenes. But when you go up to a certain level of cycles, you can almost pick up anything. Like if you had had a cold or a flu 2 weeks ago, that might register as a false positive on a COVID test. How many cycles are these PCR tests being run on? Are people being picked up for false positives? The media is not investigating that. And what we're doing is defining asymptomatic people who test positive for whatever reason as ill and quarantining them in violation of the World Health Organization's 2019 non-pharmaceutical intervention report, which explicitly advises against doing that. It's another act of taking a group of entirely healthy people and defining them as a public health threat, which is the redefinition of the social contract under the way this pandemic has been run. And so you have all these cases that are leading to a mass freakout, but you don't see yet in the United States and in South Africa increased hospitalization. So it's obvious there's an agenda here. And the agenda is what we're starting to see to continue the emergency. Now Bowser is demanding that all city employees take the booster shot or be fired. She's gotten rid of the testing option and reinstating the mask mandate because masks are a very effective perception management tool in an emergency. And there's a sense of desperation among the leadership because vaccinated people continue to spread the virus as we knew they would always do. But I see really no reason for this panic except for politics. And we can talk about who Bowser is, and we can talk about what is driving the panic. It's not elected officials who are driving this agenda. We're talking about supranational and national bureaucrats who none of us had any part in putting in their positions.
You mean like Fauci?
Fauci would be the supreme figure. And I mean, he's the longest serving federal employee, highest paid. And Fauci was the first to weigh in when Bowser relaxed the mandate. He went to the media and denounced her for a, mayor who is very ambitious like her, who is a protege of Mike Bloomberg. That's got to be pretty frightening. So it was only a matter of time. I knew once Fauci denounced Bowser for relaxing the mask mandate, I knew it would only be a few weeks before the masks had to go back on and the emergency atmosphere was restored.
Well, the RFK Jr. Anthony Fauci book is sold out everywhere in Los Angeles for sure. And if you order it online, it won't get here until the second week of January now. So that's a very popular book. It's being distributed by Simon & Schuster. So that's not a small publishing house. I think it was published by Skyhorse. And yeah. So that's a good, so this conspiratorially minded people would say, hey, Big Pharma's buying up all those books so nobody could read it. But I think people are just excited and they're hungry for that information. Here's what's happening in China. Did you see this? This is from a Twitter account, Songping Ang, and it says tens of thousands of COVID guards and health officials are arriving. This city, which has more than 10 millions of people, is in lockdown. This is from 12/19/2021, and this said 1 a.m. You want to see this? This is what. So I don't know if you could see. There's all the COVID police coming in, COVID guards. Have you seen this, Max? Are you familiar with this?
I've seen, groups that look like that are coming to administer PCR tests on Chinese campuses, but I haven't seen anything like that.
So we'll see. I mean, I don't, again, this is just for, I don't know what this is. This is just a clip I got from Twitter from this, but he's got, this Twitter thread has just a million videos like this. Like similar to this. They're all very short. But anyway, but remember when you're criticizing Anthony Fauci.
So it's easy to criticize, but they're really criticizing science because I represent science.
That's it. You're criticizing science. He represents science. He's never been. I think when he got an F on his college paper, he said, "You're giving an F to science." Is that what he said? You think when he was in college? Anyway.
When you're dumping Anthony Fauci and you refuse to go out with him, you're refusing to go out with science. When you swipe left on Tinder with Anthony Fauci, you're swiping left on science.
Doesn't it sound these people who are it's getting
just
to
take a little prick or you are a little prick.
It is getting to be like it's almost getting to be like an BDSM cult with these people who are longing for these lockdowns, right? It's like, yes, lock us down, master. For 2 weeks, we deserve it. Oh, God, look how great China and Australia have it. Lucky.
Yeah, lucky. The suicide. We need our suicide hotlines to light up the way they did in Melbourne last year.
Yes.
We want that. We want all protests to be banned as in Australia. It was wonderful.
Well, we want the drug overdoses to skyrocket. That's when you know things are going well.
Well, we got that. I lost my train of thought, but I wanted to talk about the modeling here.
Okay.
Not the modeling of like, catwalks and, undernourished.
You're talking about mathematical modeling? Is that what you're talking about?
I'm talking about mathematical modeling. The kind of modeling that we're supposed to kind of obey, that we've been taught to obey and passes for science. When you talk about the science, you're often not dealing with scientists who are dictating public health policy. And a whole swath of experts and academics is being ignored here, like historians, sociologists, and so on. But in any case, back in March, the US, the Trump administration, and the UK under Boris Johnson were planning a kind of mitigation strategy with some restrictions. But then this Imperial College, which has been funded to the tune of $25 million by Bill Gates, introduced its models predicting COVID deaths in 2020 that wound up being, in their projections, something like 5 times higher than they wound up being. They said, if you do not do a hard lockdown, you're going to see infection fatality rates at like 5%, which was just enormous. And it sent fear into the Trump administration, where Deborah Birx said we need to lock down harder. Boris Johnson imposed a much harsher lockdown because of this. And who was behind this model? It was a guy named Neil Ferguson, who has no degree in epidemiology. His qualifications are really as I think as a statistician, but someone who deals with computer models and data. And Neil Ferguson had gotten pretty much every epidemic wrong. I think with H1N1, his prediction was something like 50,000 times higher of the infection fatality rate than it was. I mean, you had all these sheep in the countryside of the UK being slaughtered based on his predictions over swine flu. And then in the middle of the UK's lockdown, Neil Ferguson went out to meet his lover to have a tryst with a married woman because his horniness outweighed his fear
of the virus.
of this virus that he said was going to kill everyone. I mean, I know blue balls can be really a bad thing, but I mean, come on, you're just admitting that you're a fraud and you're a liar when you're doing that. So guess who was the first to warn that the Omicron variant was going to be the apocalypse? It was a colleague of Neil Ferguson at the Imperial School. We wrote about this at the Grayzone, and they've been going ever since. And you see even like leftist media critics citing Neil Ferguson as a reason to lock down and get freaked out. They'll criticize the intelligence establishment and the foreign policy establishment, but they don't question these guys because they're the science. And then you even have SAGE, the British Scientific Advisory Group, issuing these dire predictions. And the editor of the Spectator, which is kind of a conservative magazine in the UK, Fraser Nelson, actually got on the line with one of these SAGE advisors, wrote a really interesting piece about it. My Twitter conversation with the chairman of the SAGE COVID modeling committee. His name is Graham Medley. And basically what Nelson was able to establish with this modeler who's advising the UK government on what to do and warning of something like 6,000 deaths on day one, 6,000 deaths a day. I mean, just really, really apocalyptic predictions, was that these predictions were based on hypothetical scenarios that did not take into account the established virulence of Omicron, that virulence wasn't accounted for at all. And they're all just different scenarios that are being presented to the government. So these hysterical modelers who've been discounted at every turn come to the government with different scenarios, trying to influencing policy. And then they tell the media the government was told that there could be 6,000 deaths a day just because they got presented with a hypothetical scenario. So the media runs with that, with frightening headlines. Then that filters down to the public, and the public becomes intimidated and frightened into submission. And then you have the hysterical influencers on Twitter. We need to lock down now. That's it. We need to lock down. That's how it works. And history should be our guide here.
Is it amazing, Max, that how people will scream that we have to save lives through COVID because the most drastic measures to save people from COVID are okay, except giving them health care. Where's that tweet, right? Nobody ever says, hey, this Omicron is so serious, we better give Medicare for all. Whoa, not that serious. It's not that serious. Like, hold your horses, slow down, baby. I mean, isn't that funny that nobody's screaming for that?
Well, that's the other argument for restrictions and panicking over Omicron is hospitals will be. We have to protect the hospital system. It's the new kind of it's the new shifting goalpost. It's not about protecting people from death. It's about protecting hospitals from overflowing. The Atlantic has a piece. The Atlantic has been kind of. I mean, it's funded by the Robert Wood Johnson Foundation, which is a major investor in Johnson & Johnson. So what the Atlantic's about. But this science writer, Ed Yong, I can't remember the headline off the top. He wrote an interesting piece basically conceding that the one size fits all roads lead to vaccination approach has failed, that you can't vaccinate your way out of the pandemic, that Omicron looks to be milder. There are encouraging signs. I mean, he acknowledges all this in very contorted ways, but then he says, because the American hospital and healthcare system sucks and is basically this like creaking hulk of a rusty disaster that has been worn down. He doesn't say this, but it's just been like whittled away by neoliberal policy, that we still have to panic over Omicron because our hospital system can't handle it. So no one's actually coming out and saying, this is the result. Like, we shouldn't even be talking about leaving people out of the healthcare system and demonizing people because they didn't take some, new pharmaceutical product. We should be pushing for expanding our healthcare capacity, and we should be punishing the hospital CEOs who've been pushing for bed cuts and all of these cuts. We should be punishing the governors, including, blue state governors who've seen enormous amounts of ICU bed cuts under their watch. Andrew Cuomo, I mean, he presided over the destruction of
30,000
emergency wards.
30,000 fewer hospital beds in New York State than there were just 15, 20 years ago. That's amazing. But don't you remember when Trump was running for president and Republican crowds would yell, "Lock her up," and it made Democrats shit their pants because that's so authoritarian. But now, when a cold shows up, everybody's lock them down. They're like, lock everybody down.
Lock everybody up.
Lock everybody up. And they don't have any... Go ahead.
Except her. I mean, except her or Boris Johnson. Like, you're not going to see those people under lockdown wearing masks. Like, Boris Johnson was just filmed just chilling out with his staff while the rest of the country was under lockdown, maskless, just having a great time. You saw these Christmas parties of British ministers joking about the lockdowns. You saw the Met Gala where the masked semi-slaves have to carry AOC and Simone Biles' ghastly dresses while they don't wear masks because they're not actually afraid of the virus that we all have to fear and lock down for. So she, or the person Trump wanted to lock up, and Trump and his pals, I mean, they're not. I don't. Bill Gates is never going to have to face a vaccine passport.
Ever.
He's never going to be excluded from anywhere.
Ever. No, never. That's never going.
So they got us all fighting each other. They're deliberately dividing us so that the global predator class can continue just hovering above us, enjoying their lives, living their best life without any restrictions, while the rest of us just point the finger at each other. I mean, chapeau to the ruling class. This has been one of their, I really give them credit. And, I never thought they would actually manage to gain so much support from left-wing media critics whose main critique has been that anyone who has a critique is an anti-vaxxer.
Yes. So people who literally have shows critiquing the government's lies are now anybody who has a critique of COVID is an anti-vaxxer. That's it. It's amazing. They will not critique COVID, the vaccines, Big Pharma, Fauci, none of this shit. And that just shows, that's just a lack of courage. And that's just fear. That's all that is. That's fear over. Go ahead.
Well, it's a lack of connection to people who are suffering.
It's that too.
The Social Security offices have been shut down throughout this whole time, ever since the lockdown. Other federal offices have come open, but Social Security offices have been closed. And a lot of these media critics and the grad students and the whatever they are, I'm a social epidemiologist, all of these, hysterical academics who just want to keep everything locked down, and they think that socialism is basically paying people like $2,000 a month to be locked in their houses. I don't think they know any of the people who haven't been able to get their Social Security. These are like poor, working class, disabled people. And the Washington Post actually finally covered this. They found that 43 million people who get Social Security have enjoyed the lowest level of service in 22 years. That from July 2020, when the offices were completely shut, to April 2021, services went down 30%. And who is it affecting the most?
That's right.
Disabled children. 51% decrease in Social Security benefits for disabled children. Disabled adults, 32% decrease. The elderly got a 55% decrease in Social Security services. People who depend on that as the one thing keeping them from going over the precipice to starvation, homelessness, and death. The Social Security Bureau actually accidentally, or they say it's accidentally, bounced 144,000 people off the rolls because of an erroneous pandemic-related benefit error, counting error. So 44,000 people didn't get their benefits because of a supposed error. I mean, it goes on and on and on. And then you have, I mean, you see it on Twitter all the time. If you dare go there, it's kind of a horror show. You see left-wing media critics actually joking about the idea that there are even restrictions or anything wrong taking place. People mocking the idea that the COVID restrictions are oppressive or authoritarian. That's been their critique. And it just shows a complete disconnect with what's actually happening on the ground in this country.
That's one way to put it. Yeah, it's a complete disconnect of what's actually happening. That's they're sitting there cheering on people who consider themselves ultra lefties are cheering on the largest upward transfer of wealth in history and the largest loss of civil liberties in this country. It's just crazy. It's just nuts. And there's nothing that's going to wake them up because fear is driving them. And they still think erroneously that we're going to get rid of this virus and we're never getting rid of it. Max.
Yeah. That's the Green Party steering committee in its statement said we need to do this to eradicate coronavirus. We're going to eradicate it.
That's never happening. You're never going to eradicate the coronavirus. That'll never happen. And that's the misinformation that the mainstream media wants people to think. And so now if it's legit in hating someone who won't get vaccinated because they're prolonging all this. And if that's what you think, I understand why you would have ire for those people. But I have ire for you for not being more critical of the fucking statements you've been given for almost 2 years now from confirmed criminal liars and big pharma. Okay.
Well, 80% of Omicron cases are being spread by people who are fully vaccinated, but who probably won't be fully vaccinated for long if Fauci changes the definition in this country.
Believe me, they're going to change that definition. And where do you get that number from? That 80%? Do you know?
I just read a headline with that, but I'll pull it up right now.
Okay. Just because I have to be super safe. Everything I say here.
Yeah.
Not like the mainstream news. By the way, they still have those videos up from NBC News lying about the child vaccination and the rates of illness and deaths from COVID. They still have all those videos up, and they're just lying. And that's mainstream news. They'll never be given a community guideline strike from YouTube. That'll never happen if you're a corporate news station. You'll never be given they might get a video or two demonetized, but they'll never get a community strike, which means they'll take your channel down. Go ahead, Max.
Okay, data from Denmark shows that over 70% of Omicron cases have been among those younger than 40, and the majority are in those who are vaccinated. That's one piece that we can put together with the puzzle, but this was reported in the Telegraph. The Telegraph reads, the Omicron epidemic is being driven by young vaccinated people, according to mounting data from countries as diverse as the UK, Denmark, and South Africa. South Africa actually has a much lower vaccination rate than Denmark and the UK.
Okay.
It won't be hard to find these reports if you look for them.
Okay. All right. Well, Max.
And that's not to say don't go out and get vaccinated. Well,
no,
it's just that's where the cases are coming from, but they're mild or asymptomatic cases in most cases, and that's why the NFL is actually listening to the science and is ending the mandatory testing for asymptomatic vaccinated players because they've followed the rules, they've done their part, and the NFL doesn't want to completely shut down. If we continue to do this, where asymptomatic people are designated as ill and constantly tested, we will sabotage society.
I agree with you, and I just encourage everybody, if you feel that you are at risk from the coronavirus, severe illness, or whatever, you should get vaccinated because it will prevent you. The data shows that it'll save you from severe illness or death. It doesn't stop.
It'll also save you from fear. It should save you from fear, right?
I don't know why you would be vaccinated and afraid that someone else isn't. I don't understand that. So if you get vaccinated, stop your bitching and go along with your life and trust the fucking science. You're vaccinated, right? Yes. You think vaccines work, right? Yes. Then what the fuck are you afraid of? Quit it. You're just dividing the country, and you're taking your eyes off the oligarchs who are still denying you health care, even in a deadly pandemic, while they transfer $5 trillion upward. Everybody come see our live stand-up shows. We're coming to Raleigh, North Carolina at the end of January and Philadelphia in February. See you there.